Good afternoon. Thank you for joining us for the daily update with details about the Riley County coronavirus response. Today is Monday, April 20th. My name is Vivian Uccello. I'm the Public Information Officer for the City of Manhattan. And joining us again today, we have Julie Gibbs, Local Health Officer for Riley County and Director of the Riley County Health Department, as well as Kurt Muldrup, who's the Assistant Director for the Riley County Police Department, and several members of the media. If you have questions during the broadcast, please leave them in the comments below, and we will do our best to address them. We'll start with a brief statement from Julie.
Great, thanks, Vivian. Hi, everyone. As of today, April 20th, KDHE has reported 1,986 positives, which is up 137 from yesterday, with 405 hospitalizations and 100 deaths. Here in Riley County, we have had 2 more confirmed positives come in as of this morning, putting us at 29 positives countywide. Our 2 newest positives include a 43-year-old male and a 35-year-old female, no relation. Of those 29 confirmed positives in our county, 13 are considered recovered, so we are still monitoring the other 16. We also have 6 tests pending, and we have had a total of 211 negative tests in the county so far. We have confirmed an alternate care site to be used if we need it. This site will serve as a place for medical provider quarantine, skilled nursing unit, a respiratory clinic, and also a swabbing site. We are currently providing drive-up swabbing, at the health department in the meantime. Since we are doing so well in the county as far as staying inside to reduce risk of exposure, we haven't needed to activate the alternate care site. We do have triggers put in place that will lead us to activating the ACS, but hopefully we won't need it. With the warmer weather upon us, it is tempting to want to be outside. This is completely fine as long as you are able to practice social distancing and allow for 6 feet between you and another person. It is not recommended to run or walk in a group unless they are individuals that you live with. And please continue to refrain from having neighborhood get-togethers. Taking care of yourself is vital at this time. Please remember to stay hydrated by drinking plenty of water, try to get in 30 minutes a day of physical activity, and eat a variety of healthy foods, and most certainly give your mind a break from the news. If you have any questions or concerns, don't hesitate to email us at rileycountycovid19@gmail.com. Also, if you're experiencing the symptoms, please call our screening line at 785-323-6400. Thank you for being such a great community. We will get through this. Stay well in the meantime. Thank you.
Thank you so much, Julie. I know a lot of hard work went into kind of the development of this alternate care site. Can you talk a little bit more? I know the decision to kind of hold off was made because the community, we're kind of doing well. The community doesn't have need of that facility at this point. Can you just elaborate a little bit more about those triggers that you mentioned and kind of the intention of the site?
Sure. So the COVID-19 Clinical Task Force, as well as members of the EOC, did get together. So this includes individuals from the county, also from the city, from Meadowlark, from Ascension Via Christi Hospital, all got together to determine what those triggers might be. We do have an emergency operations plan that we were able to put those triggers into. So if we start to see those things, that's when we can activate the ACS or the alternate care site. So we work every day to monitor those things, monitor the situation. Right now we are doing well. Our cases, we do have 29, but like I said, many of them have recovered. So that's a good thing. And so far we don't have anybody from Riley County in the hospital. So that's another good thing and something that we will continue to monitor.
Thank you so much, and thank you for all the hard work that went into that. It's nice to know that we have kind of that next level of response ready should the community need it. And I know we're all crossing our fingers that we don't get to that point. In terms of recovered cases versus active cases, I've seen a few questions, and perhaps you can provide a little more clarity about, there's that 14-day advised quarantine. And if someone thinks they may have been exposed or they've been contacted by the health department to let them know they've come into close contact with someone who has tested positive, they're required to stay in quarantine for 14 days. Then we talk about the situation of recovery for patients. So the CDC list, you need at least 72 hours fever-free, at least 7 days since the onset of symptoms. And there's a little bit of confusion out there about, that situation versus the 14 days of quarantine. Can you talk a little bit about that kind of medically for us?
Sure. It's all very situation dependent, and we do follow guidelines set by the CDC. And so that's where you're seeing those. You can actually see all of those on the new KDHE website. You can dig through there and actually find those guidelines. But we really we want to follow those guidelines. So the key words there, at least 7 days. So it is going to be situation dependent. And that, of course, is dependent on their fever, if they've been at least 3 days fever-free. And also we want to see a decline with other symptoms as well. And that is why it is very important that we monitor these individuals daily.
At the point that someone is declared recovered, does that then lift the quarantine? Are they allowed, is it safe for them to kind of leave their homes at that point?
It is. We do give them a letter that says you are recovered. So it comes directly from the Riley County Health Department. If they need that for whatever reason to show their place of employment that they are recovered. However, we still want them to abide by the stay-at-home order, as we do everyone. Only go out for essentials. If you can work from home, please do that. And it's very important for that person to still monitor for symptoms at that time. And those are orders that we give them before we do release them.
Okay, thank you for providing some clarity about that. AD Muldrup, you and I talk a little bit about kind of what you see out in the community when you go out on a call or your officers go out on a response. I needed to go out this weekend kind of for the first time and was very encouraged to see, I'd say about 90% of the people that I saw in the store were wearing masks. People were staying distant. Can you talk about what you've seen?
Sure. Great question. This weekend, I went out a couple different times and spot checked various locations around Manhattan, as well as talking to officers about things they're seeing. And as I've been saying, really kind of from the beginning of this, we're seeing a lot of really good voluntary compliance. I think businesses are continuing to learn and improve their practices and finding ways to help remind the customers where they need to stand, the various activities that they need to engage in as a business to encourage good social distancing within their business. And I think this is going to be very helpful as we, as a nation, are starting to talk towards the opening up here in time. So I think that's been good. I know we see a lot of people wearing masks out and about, both out walking, but especially in businesses. I think we're also seeing more and more businesses that have all their employees wearing the homemade masks, especially. So a lot of that is encouraging to see. It shows people are taking this serious and trying to take steps to improve things. Something else I saw this weekend and saw on our call screen, I know the weather was kind of cool at first, but as Julie talked about in her points, as the weather warmed up on Sunday and Saturday, we did start getting some house party calls with kids that were gathering together in large groups that just didn't think that the order actually applied to private property like that was what they said, and it does. These gatherings are not acceptable, and they're only going to add to the potential spread of the virus. So we had to visit a few, and I think that will increase as the warm weather gets out there and people want to get outside.
Out of curiosity, what does that kind of visit look like? What do the officers say by way of advice, or how do those calls typically go?
They've gone pretty well this weekend. A few of them were not quite so understanding. They again felt it didn't apply to them. We bring a form that we've created to kind of help them see the points of the order and that it does apply and ways that they can come into compliance. And eventually we'll probably be making contact again later to remind them so it doesn't reoccur. But in general, the officers are doing what they can to inform them, but it is important for everyone to know that citations can and will be written if necessary. It's a last resort for us. I don't think anybody needs any more financial stress, but it's critical that people, if they aren't going to voluntarily comply, understand there is an enforcement arm of the order, and they can be issued a citation, not just the host of the party, but those actually attending if necessary too. Everyone has to comply. So I think that's important for everyone to remember. We'll do the officer friendly as much as possible, but we do have the ability to take enforcement action.
If someone has a concern, maybe their neighbor's having a house party and they'd like to let us know about it, what's the best way to do that?
Again, they can use the email address of Riley County COVID-19@gmail.com. I will say though, if that's not monitored all the time, so if it's something that's urgent that needs taken care of now, sometimes we'll get an email that we get the next day about something that was occurring in the evening that they wanted us to look at. So if that's the case, if it's current, you can call the administrative line of the police department, which is 785-537-2112. That's 785-537-2112. But we prefer that you not use that for things that aren't urgent, that need to be addressed immediately. If it's about a business or something you want us to look into that we don't need to be there right now, we'd rather not tie up our dispatchers.
Okay, thank you so much for that information. Julie, we've had a couple questions come in on the Facebook page with regard to packages, kind of both through the mail and then like objects that might be purchased from the store or delivered from a store. Can you talk about some best practices for safety?
Sure. It's a good question, and one that we get quite often to our hotline or Gmail account. So we suggest that you wear gloves if you're concerned with it. Most likely it will be fine if it's a package that's being delivered through the mail. However, if you're concerned, please wear gloves when handling it, or just practice your good hand hygiene. If you're going to take it out of your mailbox, just like with anything, put it down, open it up, do whatever you need to do. And then of course, wash your hands thoroughly. Remember the 20-second rule with the hand washing. So when in doubt, just make sure that you're practicing that good hand hygiene.
Thanks, Julie. Can you also talk about the wearing of face masks? I know when I went out, I saw quite a few people were, but not everyone was. Is it a requirement, a suggestion? Can you characterize that a little bit?
It is not a requirement at this time. It's highly recommended. According to CDC guidelines, it is highly recommended that you wear a mask if you're not able to maintain that social distancing. So for instance, you mentioned going out to the stores this weekend. That would be a good time to wear those face masks, and that is to protect other people. I see it commonly done at most places that I go to, and a lot, like we mentioned before, a lot of the employees are doing it now too. So we highly recommend that.
One thing I noticed, I did have a mask on and it was hard, like it would move and I would feel the need to adjust it, and tried so hard not to touch my face. And it was a challenge, but you know, with everything that we've faced recently, an adjustment that needs to be made. We had a question come in also about travel out of state. Someone wondered if there are guidelines in place for that at this point.
Right. It's highly recommended you don't do it unless it's absolutely needed. So if it's something that's essential, then obviously you have to. But if it's not essential, then we do not recommend it. And that's in accordance with the governor's order.
Also, Julie, can you talk a little bit about the two newest cases? Were these instances of community spread?
Yes, we do believe this is instance of community spread. And like I said before we went on, I think that we're going to be seeing this more often now, more community spread. Less people are traveling, and we do have it out in our community. So I think that you can expect that. So again, just assume that everyone has it, and that, stay inside or stay at home, protect yourself, reduce that risk.
This next question is actually from Derek with K-Man. He was wondering, do tests or the test take place over the weekend? Does the Riley County Health Department conduct testing over the weekend?
So the health department does not have the swabbing station over the weekend. However, you can still get tested. You can always call your primary care provider, or you can visit KSTAT, and we would suggest that you call KSTAT first, but there is testing that's being done over the weekend.
I've noticed there's one good number that has been rising is the number of negative tests that have been reported. Can you talk about what that means in terms of spread in the community?
Yeah, so definitely we are seeing more negative tests than we are positive. Every morning that I come in, there's quite a big pile of negative tests. So we're excited to see that. And hopefully we'll get to a point where we are slowing down with our positives. They have been trickling in at 1 or 2, sometimes 3 a day. We stayed steady over the weekend. We didn't have any positives over the weekend. So yeah, we're definitely seeing more negative, 211 so far in the county.
Kurt, can you talk to us a little bit about the availability of kind of 911 services during this time? You know, if somebody were to have an emergency, what does that procedure look like? Is it still the same?
Yeah, actually, it's absolutely no different. And that's why I emphasize using that COVID line, that email address, or calling our administrative line about non-emergent things. Really, this is no change from every day of the year. We only want to use the 911 line for a true emergency, and we'll respond emergent in each of those cases. So 911 line is definitely open.
And Julie, for other medical situations or medical emergencies, we talked a little bit about last week that it's still okay to go to the doctor if you have an emergency. It's okay to visit the emergency room. Can you share a little bit of information about that too?
Absolutely. Yeah. So that was mentioned last week, and we'll continue to mention that, is that we don't want you to go without health care. Obviously, if it's not essential, we can push those things back. But if it's something that's urgent or emergent, we want you to visit the hospital or call 911. They do have safeguards in place, so you shouldn't be nervous about visiting the hospital. Please do so if you have an urgent or emergent situation.
These next couple of questions are about testing specifically. One person asked, is it true that there's a 15% false negative rate for the swabbing test that we submit?
I've not heard that specific number, and not here in the county. So not that I'm aware of, but we can get more information on that.
Okay. Also, with regard to what has come up as a little bit of a controversial test, that blood test for antibodies. Can you speak to that? Is it available in Riley County? Do we have plans to use it?
It is not available in Riley County. We don't have plans at this time to use it. The test that you're hearing about is not exactly FDA approved. It also isn't specific to just COVID-19, so it is going to pick up coronavirus in general. So I know we've heard Dr. Lee Norman talk a lot about it these past 2 weeks, and no, we don't have that available currently in Riley County.
Thank you. Do we know yet if it's possible to get COVID-19 a second time, to be re-exposed?
We don't have much information on that at this time. We've not seen it yet in the county. And so they're still studying that. There's still tests that are being done on that. There was a point in time where they did say you had immunity for a little while, but they're not sure about an extended amount of time.
Thank you. Do we have any additional questions from the media at this time? Any final thoughts from either of you moving forward?
I just want to reiterate something that I mentioned earlier, and that is give yourself a break from the news for a while, especially the COVID news. It's important to give yourself that mental break.
Okay, well, thank you for tuning in for the report today. Thank you guys for joining us, and we will be back again at 4:15 tomorrow. If you have questions that did not get answered, again, please feel free to leave them in the comment section, or email the Q&A hotline staff. Again, that email is rileycountycovid19@gmail.com. rileycountycovid19@gmail.com. Thank you very much.